We are going to get moving. It's good to see many of your faces, and thank you to those of you who have your cameras up. It's helpful to see some faces that we're presenting to. So like she said, I'm Christy Shun, and what we want to do in this session is just talk a little bit about safe sleep, and we are going to break into a couple of groups so that you can talk amongst yourselves and sort of wrestle with some of the questions that we're seeing about safe sleep. So let me just start with the basic overview. The Kansas Infant Death and SIDS Network, our mission is to provide bereavement services to families that have had babies die suddenly and unexpectedly. Like today, we provide safe sleep education to hopefully reduce and prevent many of these sleep-related deaths. And we are also doing research to make sure that we are using effective methods to hopefully reduce many of these sleep-related deaths. We use a continuum of care from preconception through the first year of life. We learned many years ago that when we were educating about safe sleep in the hospital or shortly thereafter, we were missing a lot of folks in the prenatal stage or even preconceptually. So the research shows that we need to have consistent safe sleep messages, that people need to hear about safe sleep at least 7 times before they change their behavior. And so that includes all of us, from family and friends to so many of you that are doing home visitation, hopefully prenatally and a few postnatally, then again at the hospital, and then through the first year of life. So that's our goal, is to make sure that safe sleep messages are shared consistently along a continuum of care. And I will pitch it to Maria, my coworker, to introduce herself a little bit and tell you how we reduce infant mortality.
Hi, my name is Maria Torres, and I'm the Safe Sleep Program Director here at the Kids Network. And these are the 4 components that we're using to reduce infant mortality. So the first one is the Safe Sleep Instructor certification. We do 2 presentations. We do 2 trainings a year. We used to do just one in every fall, but now with COVID, we decided to do 2 to reduce people in the training. So we do one in the spring and one in the fall. And then in that training, we embedded how to do community baby showers. So we teach safe sleep instructors how to set up a community baby shower for safe sleep. And then we also teach them how to become hospitals. So if they work within the hospital system, we have a project developed with Chris for Kids to certify hospitals. We didn't embed that. It was through Chris for Kids in Pennsylvania, and we're working with them to make to certify hospitals on becoming safe sleep. And then the last one is Safe Sleep Start Outpatient Toolkit. That is for clinics, pediatric clinics, family medicine clinics, and OB clinics to start teaching safe sleep during these visits when the moms are coming for the prenatal care, or when the moms are visiting just family medicine doctors and then in the pediatric. So that's how we're reducing safe sleep, infant mortality here in Kansas. And then that project has just become has been categorized as a promising practice by the Association of Maternal Child Health Programs. So we're going to be continue gathering data, and hopefully the project will reach the final level of becoming an evidence-based project in practice. So we're hoping by doing all this project that we become evidence-based.
All of the trainings that we do and all of the information that we're sharing with you are based on the American Academy of Pediatrics. So Maria just talked about the Safe Sleep Instructor certification. And I just want to run through safe sleep very quickly, just to kind of give everybody a quick refresher on what the AAP is recommending. So we know that babies need to sleep on their back to sleep for every sleep. They need to be on a firm surface. Breastfeeding reduces the rate of SIDS. Room sharing with the infant, but on a separate sleep surface, what we call same room, separate bed. We know that we need to keep soft objects and loose bedding out of the crib. We know that considering or offering a pacifier at nap time and nighttime reduces the rate of SIDS. We know that we need to avoid smoke exposure, alcohol, illicit drug use, and avoid overheating. AAP went on to say, we know that pregnant women should seek and obtain regular prenatal care as a way to reduce sleep-related deaths. We know that infants should be immunized in accordance with the AAP and CDC recommendations. We also know that home cardiorespiratory monitors are not a strategy to reduce the risk of SIDS. We also know that healthcare providers, NICU staff, newborn folks should endorse and model, so not just say that safe sleep is important, but also model that it's important. And in 2016, when these recommendations came out, the AAP had added that media and manufacturers need to follow safe sleep guidelines, so that when we see messaging and advertising, we see babies sleeping in safe environments. So we don't show what not to do anymore. We show everybody what we want them to do. On that note, I want to let you know that the American Academy of Pediatrics reviews these recommendations pretty much constantly, and then they update them and resubmit them for publication in every 5 years. And so we are sort of waiting at this moment with bated breath for the new recommendations to come out, because it has been since November 2016. So as soon as we get those out, you'll see all that information come out from the Kids Network and the AAP and the Associated Press. So one of the things that the AAP said in 2016 is that they encouraged healthcare providers to have open and non-judgmental conversations with families about their sleep practices. We don't want to shame people. We don't want to make people to feel bad for what it is they are doing or what they were taught to do or what is part of their culture. So the AAP called for us to move towards conversation. And so just in a nutshell, what a conversational approach is a shift from being an expert who makes recommendations to being more of a resource who supports the family. And I think this really is dovetail with home visitation. So you know, as home visitors, to address them and the myriad of issues that you're talking about is start where the parent is. Use a client-centered approach. Make good eye contact. Let them know that you care, that you're listening. Tell them stories rather than just, the rules and the guidelines and the recommendations. We need the recommendations to build off of, but that we can use stories to help share what could be done or what needs to be done. Think about your beliefs and what you think should be done, maybe the way that you raised your children or that you were taught in your family, and figure out what's different about your situation and maybe the situation of the clients that you're working with. And then finally, the conversational approach encourages people to take a non-judgmental approach. And sometimes that's hard to do, especially for some of us who are maybe seeing the poor outcomes from unsafe sleep, that we can get kind of judgy in our tone of voice and the way that we address people. And so what the AAP is calling for is we as healthcare providers really move towards a conversation where we're engaging and starting where the client is and letting them know what the guidelines are, what the recommendations are, and problem solving and trying to figure out how they can practice safe sleep. So in order to do this, what we are going to use is something that's called the World Cafe discussion model. And World Cafe is really just a flexible format that it hosts large group dialogue to help us brainstorm. And so Maria and I are going to walk with you through a couple of scenarios and some questions, all based on the AAP. And what I need you to frame when you're in these breaks, you're going to get into breakout groups. And there's going to be about, maybe 8 to 10 of you. What we'll ask you to do is introduce yourselves. So these are sort of progressive rounds of conversation. And we'll pose a new question that you will then answer in your group. So this first question, or what we call round one, I'm going to pitch to Maria. But what I want you to also remember, I just thought about a little bit ago, is sometimes it's easiest when you get into the breakout room, because you won't have these slides, is to take a quick snapshot of the question. So if you have your cameras handy before you get into the breakout session, take a quick snapshot of this so that you know what you need to be talking about in the breakout session. And then we will pull you back into the bigger group and we'll report out for a minute or two. So what you're doing is we're going to have progressive rounds of conversation. We're going to pose a new question, and then you will go into that group and discuss it, strategize some of the ways that you can respond to the statements, and then we'll come back and share that with the broader group. So Maria, do you want to take it here and just introduce this first question?
Yes. So like Christy said, just make sure you take a picture. I'm pretty sure you probably already did, but if not, please take a moment to do that. Take a quick picture. Basically, what we want you guys to do is what pushback have you heard about position, safe sleep position? This is a couple examples, but you guys came up with more, and then we will report out like Christy said. So one of them says, my baby won't sleep on their back. They sleep better on their tummy. Worry about child choking after reviewing the information. So I will just, if you guys have any other ones, any other pushbacks that you have heard from moms, you're a moms, you are doing home visitation all the time. So have you heard anything else? And then one more thing, we want you guys to think ways to respond to these statements. So we will do the breakout rooms right now, and we will be back in 8 minutes to report out. Krista, are you going to send us to the breakout rooms? Okay.
I just want to check in with you as everybody's being pulled back over here. Can you see my slides again?
Yes.
Okay, when I go join a group, I have to stop sharing. And so I just want to make sure that people are sharing. Okay, so you're going to run us through, maybe Krista can let us know when everybody's back in also. I don't want to start if everyone's not back moved into the main group.
I don't think we're all back. We had 47 when we started, and we are 42, so.
There's one person that's not left yet, but they should come automatically back.
Okay.
Okay.
I think you can go ahead, Maria.
Stepped away from their computer.
Okay, so who wants to raise their hand and share with us what you guys discussed in the groups? Okay, Tina.
Okay, I was in room 5, and we talked about the pushback that you hear. A lot of us have heard like, no, we can't sleep our baby on the back because my mom says she always left her babies on the stomach, and that's the best way to sleep them. And we talked about the way of educating that, you know, yeah, we were lucky that nothing ever happened, but you know, now that we know, we have statistics that say sleeping the babies on the back is more safely, we want to push that. Also, we talked about like always having the baby on a hard, firm surface. They don't like it, and or a lot of them that say no, my baby's gonna vomit, my baby's gonna choke and die from being on its back. And I always told them, because I've listened to Christy for years, and I always tell them what Christy taught me. Well, a healthy baby has enough force to push projectile all the way out or automatically turn to the side. And so that's what I always use. And then also, if they're really reluctant, I go into talking about, you know, that the baby has to be on a hard, firm surface because the esophagus has to be down and that it won't go into the lungs instead of into the stomach. So we talked about that. And, you know, one of the girls, she also said about telling them about the pacifier. The pacifier helps. And another thing we talked about a lot is in our group was like covering the babies way too much. Like even if it's 100 degrees outside, they have that baby swaddled in blankets. And, you know, just tell them the rule of thumb, they only need one thin layer more than what the mama has on.
Thank you, Tina. Yeah, great points. Any other ones?
So I'm going to move to the next slide just so we don't run out of time. That was, I said to the group that I jumped into, that was sort of the precursor, get your feet wet, and then we'll get into some harder conversations. I think just in a nutshell, we want to share with folks that we are there to listen, that we are there to make eye contact, that we are there to share dignity and respect. And so listen to their story. Like Tina said, give them some of the feedback as far as what the recommendations are, some of the research that we know, and also maybe add some stories. You know, we want the best. I want the best for your family, for you and your family, and I want the best outcome. So I'm going to share these things with you. At the end of the day, ultimately, you make the decision, and I just want you to have the best outcome possible. On the next slide is round 2, and I hope that I got there okay. Oops, didn't go. There we go. So this is round 2. We're going to break into breakout groups again for 8 minutes. You'll be in the same group. Now I want you to talk about what pushback have you heard regarding bed sharing? So bed sharing is when baby sleeps in the adult bed or in a shared sleep surface. So sometimes we hear things like bed sharing is protective. How would you as the home visitor respond to that? My baby won't breastfeed as long if I don't sleep with her. How would you respond to that? I'm exhausted and I have to go to work. How would you respond to that? My baby won't sleep if they aren't right next to me. How would you respond to that? So strategize some ways to respond to these statements as a group, and Maria and I will kind of pop into different ones. So Krista, if you can shuffle us into groups again, we'll bring you back in about 8 minutes. Just fine. I am going to jump into our next slide here. And I'm sorry, I am not using presentation mode anymore because this happens almost every time. When I get to the middle of the presentation, I can't see your faces anymore. So I would rather see you than my slide. But what kind of reporting out can we do? What kind of statements have you strategized to come up with some of these barriers?
One of the things that I had said when we were talking was just being honest with our moms. I was explaining to the other members in the group, I'm a femur abstractor, and that's one of the things that we do see and look at is infant deaths due to unsafe sleep conditions. So I think sometimes we want to kind of avoid, fear mongering and scaring our moms, but sometimes, like I said, it's a good idea to just keep it 100 with them and tell them, okay, these are what statistics are, this is what we're seeing, and this is why we're sharing this with you. It's not because we're trying to control what's going on in your home, but we just want to share with you because we want what's safest for you and your baby. So just transparency, I think, is key to having these open discussions with parents.
I think that's perfect. That's really good. It's just that it shows dignity, it shows respect, it shows listening. What other things have people identified as sort of ways to have a conversation with parents when they come up and say, I just really feel like I'm too tired. The baby's got to sleep with me. There were a couple people in my group that had some really good suggestions. You guys feel like being put on the spot?
Yeah, I can share some of that. Like I was saying earlier, just one of the ways that I strategize with my families is having, my thoughts are gone. There they are. Oh man, give me 1 second. No. I'm sorry.
No. I wrote your notes down, so I might jog your memory. You give them some tips to help baby get to sleep. Yeah. And then you also strategize how to make the baby comfortable.
Yes, during the day, most of my family's babies sleep either in the crib or the pack and play. Some have their beds and none, and so I encourage, creating a safe space for baby. But just getting baby familiarized with the space of the crib and pack and play during the day, and helping baby to transition that during the evenings. And some of the things, I got more now. And I always say, like, just setting the mood, setting the mood of dimming the lights, finding what works best for your baby music. I had one family play this one country song that baby will only sleep to, and it was just lots of, but it's just finding what works for your baby and just using those tools to transition the babies into that space from bed.
Yeah, no, that's great. I think exactly what you're saying is sort of creating the environment so that they can be as successful as possible. And that's sort of the glory of you guys being home visitors, is hopefully you're able to see some of these folks beforehand, and you're going to be able to see them not just one time. This isn't just at the bedside when they leave the hospital, but you can go back and ask them how it's going and really have an in-depth conversation. A lot of times new moms just need to be heard. They just need to know that this is exhausting. This is tiring. We are asking them to do a lot, And so just being able to be a set of ears and eyes that listens to them, and then you're going to come back. You're going to have another conversation with them later. That's worth a lot. Other comments? There was a couple of other comments in my group or other groups of how you would strategize some of these statements. Okay, I'm just going to say it if somebody doesn't want to, because I thought it was a brilliant idea. And it was, and I've kind of heard this through the last two slides is, and I don't know, I mean, I get the gist of what she was saying. As a parent, it's our job to train babies and to sort of create a culture for our environment and let them know what the boundaries are. And so you can start this now. You can start this right when the baby comes home. And so a lot of times people will say, you know, my baby already sleeps better on its tummy than it does on its back. And I'm like, I wish we had never started that. That's why we want to get in prenatally and say, from the get-go, you need that baby sleeping on its back to sleep. Because once you give them the opportunity to sleep on their tummy, it is warmer, it is more cozy. So we just don't want to ever get them there. So start the back sleeping from the get-go. And same thing with sleeping in the adult bed. If they're already sleeping there or in that position, then you have to slowly move them back. And so one of the things that I think I said last time is, can you just do it one time? Can we just bargain a little bit to get your baby in a safe sleep environment for the next nap time? Tell me how it goes when I get back, when I see you next week or talk to you next week or in 2 weeks, whatever your schedule is. So we've spent a lot of time in transition. And so I think we're just going to do round 3 in this group instead of doing the breakout session, because it just takes time to get there and back. So Maria, would you be willing to just do round 3 with the whole group, and please just speak up, chat something based on what your thought is.
Yes. So the third question says, what pushback have you heard about commercial devices? I use a heart rate monitor so I know if my baby stops breathing. I use a swing for sleep because my baby won't sleep laying down. She has reflex. What other barriers have you interact? What have you heard about commercial devices? And maybe in this one, just raise your hand if you want to talk.
So Stephanie, I'll give you just 1 second, Guillermo. And one of the things I say is, yes, they sleep better and deeper on their tummies, but their bodies aren't fully developed, and that's not necessarily a good thing for them to sleep that deeply. Absolutely. You know, a good baby is every baby, not just one that sleeps 6 or 8 hours. A baby who sleeps 6 or 8 hours scares me, because babies are programmed to sleep about 2.5 hours at a time. And so once moms know that that's sort of their cycle, and dads too, that sometimes can relieve them. So yeah, a good baby is all babies. And it's not necessarily really a great thing for them to sleep 6-8 hours at a time. Guillermo, what were you going to say?
I wouldn't say, I've had some that just prefer the swing incline. They sleep in the day, a lot in that throughout the day. And then there's others that I think it just comes down to, I don't know if it's just lack of access or grants to providing pack and plays or safe sleep equipment that are safe for us to give. But I think that's just some of the things that I've noticed on my end.
That's really good. You know, there's a lot of people that are doing a lot of different things because they don't know. And so my statement here, and we're going to close up here in the next couple of slides because we have about 5 minutes left. But with these heart rate monitors, these swings, these we sometimes refer to them as buckets, because we can put babies in different mechanisms all the time. The thing is that just because it's on the market doesn't mean it's safe. And many of these items have been recalled. And so I would encourage you all as home visitors, if somebody has a question about one of these mechanisms or devices, that you go to the American Academy of Pediatrics, call the Kids Network, go to the Consumer Product Safety Commission to make sure it hasn't been recalled. A lot of folks stopped sleeping in the same bed with their baby, and they put their babies in these things called a rock and play. And the rock and plays have now been completely recalled. Unfortunately, they're still on the market. So we have to really help people figure out how to drill down and get the baby to sleep, hopefully just at arm's reach in a safety approved portable crib. It doesn't need to be some other mechanism. And somebody said earlier, the babies need to develop. They need to have range of motion. They need to be able to move their arms and their legs, and they need to learn to crawl and sit up eventually. And if we constantly have them trapped in some kind of a mechanism, they can't do that. And some of those mechanisms, although you can buy them, aren't safe and are actually lethal. So with that, I will move to the next slide. So thanks for bearing with us as we move through. So Maria, you want to talk for a minute about this project that we have going on for more information?
Yes. So we're doing the safest sleep instructor training. Like I said, we do 2 a year. And if you guys are interested in becoming a certified safest sleep instructor, you can contact me, or you can contact me. My email is ssi director@kidsks.org. Right now we have like 130 to 40 safest sleep instructors across the state, plus around in the United States as well. We have some people in Colorado, we have some people in Nebraska, we have some people in Mississippi. So just contact me if you are interested in learning more about how to become a safe sleep instructor. It's designed for home visitors, nurses, law enforcement, child care providers, fire department, anybody who will be in contact with kids or babies. So just let me know, send me an email. Christy put it on the chat. If you guys want to know more information, or Christy or Krista, somebody put it in the chat. So just contact me if you guys want to know more information about the project. And then we, like Christy said, are you putting the slides? There we go. And basically, this is what the safest sleep instructors are required to do the first time that they are a bronze level safest sleep instructor. So basically train 10 people or train professional caregivers. So if you guys are going to homes, you guys already have that done because you're already training these moms. So basically just the only thing you will be doing extra will be collecting the pre and post test. We're collecting data because remember, we're trying to become evidence-based project. So we're collecting data. So we're doing a pre and post test every time you train these moms. If it's caregiver, it's only 4 questions that they have to answer. And it's really quick. You're already doing that with the home visitors. Go ahead, Christy.
So I'm going to interject for just a second. So this Safe Sleep Instructor certification is available a couple of times a year through the Kids Network. You can become bronze, silver, or gold. We are also piloting a home visitation crib toolkit. And so you are in the homes on a regular basis, or at least on Zoom with them. So we're working on making sure that you have more information and tools to use to sort of assess where they are with their crib. Are they using it appropriately? What questions they have, just as a conversation starter. So if you are interested in this, and our last slide will have all of Maria's information. We just want to say thanks to the people who, in our last 30 seconds, the folks that allow this project to work. So Kansas Department of Health and Environment has provided a grant to get the Safe Sleep Instructor certification off the ground, and a lot of support from Safe Kids Kansas and the Center for Research for Infant Birth and Survival. And like Maria has said, a lot of the data is collected, and really Cribs helps us sort that and figure it out. So if you are interested, if you have more questions about anything that we've talked about already, if you are interested in the Safe Sleep Project, you can join us on Facebook, Instagram, Twitter. You can call the office. Maria, I didn't put your email on there, but it sounds like somebody put it in the chat, and that is just ssi director@kidsks.org.
Yeah, thank you, Krista. You put it in there.
Krista did it. All right, thank you.
And Crystal has a question. Is there a list of baby items that are safe, or list of popular baby items that are not safe?
There's not a list per se. It's really the safe sleep recommendations. And so if you were to go to our website, kidsks.org, I could lead you there if you wanted to call us. Really, it's the American Academy of Pediatrics has a technical report, and they tell you what to use and what not to use. but there's not just like a checklist of what you can buy and what you can't buy. Yeah, it's a good idea, but the list is constantly needing updated, I guess, is what would be hard about that. So if you want to give us a call, I can walk you through some things. Maria, do you have some ideas?
If it was me, basically they just need clothes, diapers, and a safety approved crib. That's pretty much it. That's what I told my moms, because a lot of them say, well, what about the swing? What about the bouncer? Well, how much is the bouncer? How much is the swing? They don't need that. The portable crib, you can move the crib everywhere they go. They have wheels, so you can, it's portable. So I just told my moms clothes, diapers, and a safety approved crib.
All right, well, thank you so much. We are at about 3:47, so I'll stay on for a couple of minutes. If you have questions, I'll field them. Thank you, Maria. I know you have another appointment to get to, and many of you are on a break. So it's good to see you. Thank you for the work that you do and participating in today's webinar.
Thank you.
And thank you, Christy and Maria. I'll see everybody at 4 o'clock.
All right, it looks like there's no questions. It's good to see so many of you. Tina, thank you for speaking up. Well, if there are not questions from some of you, I think I will sign out, and I hope the rest of the training goes well. It sounds like there's another hour or so. So take care, thank you, and we'll see you around.